Namaskar, I am Dr. Himanshu Bavishi from Bavishi Fertility Institute. Today I am going to talk to you about a very important subject, embryo quality, and particularly poor embryo quality. Why some of the embryos which are made are of poor quality. When the embryos are made and we find that the embryos are of poor quality, it is very frustrating. Patients almost lose hope that now they are not going to get any result because anyway the embryo quality is not good. It is partially true as well because the embryo quality is an indirect parameter of the success chance, and hence if the embryo quality is not good, naturally we expect poorer pregnancy chance. Now, what can be the cause of a poor embryo quality? It is a multifactorial thing. It's not only one reason we can always pinpoint, but however, I like to discuss some of the important points which we need to understand and evaluate if we see that the embryo quality is poor. We also need to understand that what we mean by embryo quality is the morphological appearance of the embryo. That means how the embryo appears to you when you see in the microscope. It starts from the egg quality, fertilization, fertilized egg quality, then the process of cell division and the appropriate development of embryo on the day you are seeing the embryo. However, all these again is morphological. That means you are seeing the embryo and you are judging it. But not necessarily it's a parameter of the fertilizing potential of the embryo or the genetic content of the embryo. But however, that is the only option we have, and that's why we have to rely on what we call as morphological quality of embryo. And that is where the best way to evaluate the morphological quality of embryo is blastocyst culture. We allow the embryos to grow beyond 4 days and see how the embryos are developing and what quality of blastocyst we are getting. Based on that, we can evaluate the quality of the embryos. Now, when we talk of the factors which can affect this embryo quality, don't forget the male factor, the sperm factor. A poor quality sperm also can be responsible for poor quality embryos. A poor quality sperm may not be necessarily low count, low motility, low morphology, but even the DNA damage in the contents of the genetic material of the sperm can cause a poor quality and poor success rate. So don't neglect the embryo quality subject. Consider the sperm as not important so far as the embryo quality is concerned. Now, when we talk of the female partner, age of the woman is most important because again, as I was talking to you in the sperm DNA problem, egg DNA problem also is there, and that problem increases with the advancing age of the woman. So that is one of the most important factors which we need to consider when we consider embryo quality. However, age is not in our control, but the second most important thing is the stimulation protocol. We use different protocols to stimulate the ovaries of different ladies depending on multiple factors, age, ovarian reserve, preference, and so many other things. So we can optimize that stimulation protocol and try to get good stimulation, good hormone production, good size of the follicles and proper timing of that so that we can get good quality of eggs, and at the same time for the final maturation of these eggs, it is called trigger, and that trigger is also equally important. So a good trigger, a powerful trigger and an effective trigger, that also we confirm by various methods, and we make sure that we have done good stimulation and good trigger. That definitely helps us get the better embryo quality. Then comes the crucial stage of taking care of the most delicate gamete, that is female gamete, that's egg or oocyte. Right from the moment we take it out from the body of the woman, fertilize it in our lab, culture it and make the embryos and then put it back. How much care we are actually taking, what quality of IVF lab we have, what quality of environment or air quality, that is air handling unit and class 100 air quality inside the IVF lab, what kind of equipments we are using, what kind of culture media we are using to grow and provide nutrition to the embryos, what kind of people are handling those eggs and embryos, what skill and experience they have. All these are very, very crucial to take care of the eggs and making them better embryos. So sometimes it may appear that what's the difference, but there is a huge difference. Man and machine both are equally important. One more important point I would like to highlight here is that even a good looking embryo is not always good. The good looking embryo may not be genetically normal. Then how do we understand whether this embryo is genetically normal or this is not genetically normal? There is a technology called PGTA where we do the genetic testing of the embryos before we put them back into the uterus of the mother. So if we use this technology, then we know that this embryo, though it may look bad or good, whether it is genetically normal or not. So if a patient has done treatment cycle and she has produced not good quality or poor quality embryos, does not mean that she will always produce poor quality embryos. Good stimulation, selection of drugs, protocols, monitoring, trigger, taking care of eggs, fertilization process, embryo culture, quality, taking care of embryos, and the process of embryo transfer, all put together definitely can make a big difference. So what you need to choose is the clinic which has a capability to handle this kind of situation, understand and evaluate the reasons for poor quality, and make necessary corrections to better the outcome of your treatment cycle. I hope you like this, and if you want to know more about PGTA and other subjects, keep watching our video. Thank you for watching. All the best. Namaskar.